I think we should all be up here. Okay.
We have others burning. So I'd like to welcome everybody and thank you for attending this press conference on the important issue of lead in Allegheny County. I'm Dr. Lee Harrison, Chairman of the Allegheny County Board of Health and Professor of Medicine and Epidemiology at the University of Pittsburgh. The Board of Health has taken a keen interest in the lead issue in Allegheny County and is looking forward on voting on a universal screening regulation at our May meeting. The purpose of this press conference is to briefly summarize the lead problem in the county, outline what actions are being taken and the progress that has been made to date, as well as outline what still needs to be done and what parents can do to protect their children from lead. To my right is Dr. Karen Hacker, Director of the Allegheny County Health Department, who I assume everybody knows. We also have an excellent panel of pediatricians, advocates for child health, and experts in toxicology. After brief presentations from Dr. Hacker and each of our participants, we will have time for questions and answers. I would like to also introduce Dr. Debra Moss, Associate Professor of Pediatrics at University of Pittsburgh, who has extensive experience in interventions to improve the quality of care for underserved populations. Dr. Amy Nevin is a community pediatrician affiliated with Children's Hospital of Pittsburgh. Dr. Bernie Goldstein is former Dean of the Graduate School of Public Health at the University of Pittsburgh and an expert in environmental toxicology. And our final speaker will be Dr. Patrick Dowd, Executive Director of Allies for Children, a child advocacy nonprofit dedicated to promotion of policies that improve the lives of children. Thank you, and with that, I'll turn it over to Dr. Hacker.
Thank you. So first of all, I really want to say how much we appreciate you all being here today, because part of the challenge is being able to explain this information to public, to make sure that they understand how interested and committed we are to this issue, but also to really dissuade anxiety and to make sure that individuals really understand the facts. So I really appreciate your being here today. As you probably know, there's been a lot of attention to this issue in the media, and in some cases it's somewhat confusing to individuals. So today we really wanted to clarify with all of you the information that we have, that we know. There are certainly things we don't know, and we are learning more every single day. I'm going to start by just saying that we do know that there are toxins associated with lead, and that lead, as you can see, exposure to lead can be very harmful to children. In particular, it impacts the neurologic system and can impact further learning disabilities as time goes on. We also know that there's a lot of different sources of lead in our county in particular, and those include paint, chips, and dust, soil, as given our industrial past in particular, and gasoline that used to have lead in it, and the lead pipes that we've certainly heard a lot about. But I also want to remind you that certain toys, particularly from China, have contained lead paint, and we've had cases where children have eaten those toys and become poisoned as a result of that, and types of jewelry also may include those things. So these are all of the types of areas that we really feel strongly we need to be able to mitigate. Now, in our county, over the last years, just as we have seen nationally, we've been seeing a downward trend in the number of children who have actually what we consider to be lead toxicity. And the chart over there particularly talks about children with lead levels in Allegheny County that were more than equal to 10 micrograms per deciliter. You may know that in the past, children who were very symptomatic, they usually had lead levels that were far above this. They were 35, they were 45, and those children ended up needing to be in the hospital to receive treatment. Today, most of what we're talking about are children that we consider to be asymptomatic, meaning they're not really displaying any type of symptoms or anything like that. However, as you can also see that there's some variability in these graphs, and part of that is because we do not have universal testing in our county at this time, and so every year we have a different number of children who are tested, and that number has been relatively stable, drifted downwards, and then sort of drifted upwards over time. The types of things that you see on this graph, for example, we don't know if there was anything particular that drove that slight uptick in 2009. I know that there's been some concern about the slight uptick in 2014. I can tell you, and you'll see some further data, that that is not a significant indication of any kind of issues or emergency situation going on. Now, the second thing, though, I wanted to mention is that we also look at the above 5, because the Centers for Disease Control has now gone on record basically saying not only that no lead is safe for children, but that the lead level that we used to find acceptable, or at least what we would go and investigate, has now been dropped. And as typical in public health, as we begin to do improved work, the levels start to go down, and we start to readjust what the metrics should be. So we've been doing that, and the new level of lead level that we're concerned about, or it's called the reference level, is actually 5 micrograms per deciliter. And you can see here that when we look at that across our city and county, those levels overall, that includes a lot more children, no question. That includes the 10s above that, as well as all the 5s, has been going down consistently over time. Now, we feel that overall we are making good progress, and as you'll hear later, we are putting a lot of our time and energy into this, but it's really important to understand that we are not alone in this. We really need the commitment and the participation of all of our partners. We need to work with other government agencies, state and locals, advocates, the pediatric community to really get them to not only test children, but to also consider the education that they can give to families and the tracking and the referral that goes on. I do want to mention that we did go and use the CDC methodology to look at the number of children who have actually had lead levels above 5 before, during, and after the corrosion control changes that went on at PWSA. And as you can see here, those numbers have been going down as well. The last thing I wanted to mention here is we have also been using the data that we have, and again, I would say that with 15% of our children tested, it is not a representative sample. And I don't know if people understand what that means, but we have about 20,000 children, I believe, in the city of Pittsburgh under the age of 6, and we only have a portion of those children who are actually being tested. And in most cases, my guess is that the highest risk children, particularly our Medicaid children, are the ones who are being tested. And we don't really have a good understanding of our entire county as well. And as you can see from the maps, which are right there, what we've done is we've taken the actual numbers of children with high lead levels, both above 5 and above 10, and we've mapped it against our housing stock that was built before 1950. And 1950 means that the lead in paint was even worse than it was between 1950 and 1978 when it was finally removed. What you can see is if you look at anything that isn't the bright yellow there, is an area that has somewhere between 17 and 36% and up of their housing stock built between 1950. And what you can see there is that we have many areas of our region where there really is very little testing taking place. And again, as Dr. Harrison mentioned, this is one of the reasons that we feel strongly that moving to a concept of universal testing will give us information so that we can better inform the public, we can better inform all of our activities, and we can really get this down as low as we can possibly go. Again, I do want to just remind people, and you will be hearing this from our later speakers, about how much improvement has been made to date, but we always have more work to do. And so I'll talk a little bit later about what we've actually been doing as a health department and where we think we're going from here. But at this point, I'm going to turn it over to Dr. Moss.
Thank you so much for this opportunity. I hope you can hear me. So I'm Dr. Debra Moss. I am a pediatrician at Children's Hospital Primary Care Center for the past 20 years. And certainly there's no question that lead is a health hazard for children. So as a pediatrician, my job, my goal is really to protect children from health hazards and keep them as healthy as possible. So for the past 20 years that I've been in practice, I've tested every single 1 and 2-year-old child for blood count and lead level. And I will say over this time I have not seen an uptick in lead levels, and certainly I've been extra aware after Flint, the Flint, Michigan crisis, that I'm even more hyper aware than usual, but I have not seen an uptick in elevated lead levels. That said, for any child who does have an elevated lead level, so above the level of 10, they qualify for an environmental lead investigation, which is a thorough investigation of where the child resides, and I get reports of those environmental lead investigations for the children who have tested high. And in those reports, I have seen that the main source of lead exposure in children has been paint chips and paint dust. There's been some soil as the culprit, but I have not seen and have looked for water as the source, but it has not been there, at least in the reports that I've read of the children with elevated lead levels. So I think that's something that I'm keeping in mind because I want to make sure that I stay focused on the risks posed for children that I take care of and in our community. The other thing I really wanted to say is, just like Dr. Hacker said, the lead testing in our community overall certainly has been spotty, and so we don't really have a full picture of what is the risk in our community. So I fully support the concept of expanded lead testing in children so that we can get a full and complete picture of where the high-risk areas, where are the at-risk children, and what kind of measures and interventions we can take to best protect children. My final point is really that all of this is just part of the picture, and obviously when a child tests positive for elevated lead level, it certainly is a symptom of substandard housing, and I want to make sure we also attend to that. And as Dr. Hacker said, we really do want to think about this effort to protect children from lead exposure as a community-wide collaborative effort that's going to take all agencies and organizations on deck. Thank you very much.
Yes, grab my notes. Thank you. So hello, my name is Dr. Amy Nevin, and I spent 12 years of my career as a pediatrician in the Beltsuver and surrounding hilltop communities of Pittsburgh, and commit myself to advocating, especially for children at risk. In my current educational work, I support doctors in training to use their voices to speak up for some of the most vulnerable of our community, our children. Pediatricians as a group are dedicated to mitigating risk of all kinds, whether it's domestic violence, general violence, food insecurity, or of course, toxins. I became passionate about lead poisoning over a decade ago due to elevated lead levels that I was finding in many of my young Pittsburgh resident patients. And I speak today to offer the perspective and experience of a community pediatrician who has seen dozens of cases of elevated blood lead levels in children as young as 9 months of age. While we should look at all sources of lead, I want to be sure that we don't lose focus on what we know is dangerous to children. When the homes of these children in my practice were evaluated, regardless if the year was 2005 or 2016, the culprits of the poisoning in each home were always identified as paint. A crack in the wall which seemed minor, teeth marks on a door jamb by a toddler, outdoor house paint that was blowing lead actually into the backyard of a play area of a young child, were all identified in children that I know. When families became aware of these issues and these specific exposures were mitigated, then the lead levels came down. A loving parent or grandparent in an aging home struggling with its upkeep can unknowingly be exposing his or her children or grandchildren to the effects of lead paint. I have seen this. Even a home once in good condition can deteriorate over time and cause problems it never did in the past. So what pediatricians would like families to know is this. The lead levels in general will rise in a child who is exposed to a lead environment between the ages of 6 and 12 months, peaking between the ages of about 18 months and 3 years. And then they tend to gradually decrease after that. At the late infant age, that's when children are starting to explore around and cruise and crawl and pull up and explore a lot, often orally. What a lot of people do not realize is that lead paint actually tastes sweet. So when a child sometimes gets a taste of that, they want to taste it again, and people sometimes are not aware of that. Again, dust is a major contributor. You think about a 10-month-old that's pulling up to stand at a windowsill and all the dust that's in that window well, with so many of our houses in the county being before 1978, being built before 1978, that's a lot of kids in our area.
And I also want to stress that wooden porches are with old paint that's peeling or chipping or even eroding in a dusty fashion is a common culprit of lead exposure. And with summer coming, it's important to know this because it's a common play area for children, especially in the summer. And it's also why a child in these homes may even have a higher lead level if they're tested in the summertime. Thinking about what lead paint may be in the home is the most important and vital first step, and raising public awareness is important. These points that I make about porches and the taste of lead paint are almost never in the news, despite all the increased publicity that lead has had. I'm a doctor, not a lead abatement expert, but I can tell you what I've told other patients' families, which is to keep the home as dust-free as possible and flush mop water down the toilet. Test the paint in the home to think about exposures before they happen, and there's test kits at places like Home Depot and other housing stores. The Healthy Homes program through the county can provide really important identification of potential risks to the child. And the CDC website, but also the County Health Department's website, has very useful information for families. Like Dr. Moss had mentioned, progress certainly is being made. Overall, for decades, the rates of lead poisoning nationally are decreasing, as they have in the city of Pittsburgh and in the county, in Allegheny County. Locally, pediatricians are not reporting upticks in lead cases, and that's wonderful. However, the goal of doctors is that no exposed child is unidentified, and prevention and early detection are vital. And that's why I, as well, strongly agree that we need to recommend screening everyone in the county, the children, ages 9 to 12 months, and again at age 2 at a minimum. This is based on good science and evidence-based recommendations from the American Academy of Pediatrics due to the age of the housing stock in Allegheny County. The more children we screen, the fewer we will miss, and the trends in exposure can continue to be closely monitored. Thank you.
Thank you, Dr. Nevin. Dr. Goldstein?
Thank you, and good morning. First, I want to commend all who act to decrease the lead burden of our children. It's really important. And I want to also commend the Allegheny County Health Department for wanting to go beyond the standard Centers for Disease Control, Canadian and other international recommendations as to what to do about lead. I'm a toxicologist, I'm a physician, an internist, I'm a member of the National Academy of Medicine for the work I've done in toxicology, and one of the things I did was to become the Assistant Administrator for Research and Development at the U.S. Environmental Protection Agency, basically the chief scientist there at the time that we removed the last lead from gasoline. And there's a placard up over there showing the average blood lead levels and the lead used in gasoline, and you can see just how they go right along with each other. Actually, it doesn't even go down to the last lead because we got that out in the 80s. But the other point I wanted to make, just to put things in perspective, is if you look at the blood lead levels in 1976, the average for children in the United States was 16. We're not talking 5, we're not talking 10. We're basically saying that anyone here who's, in their 40s, that's what you had, okay? That's what I had. Based on the science showing lead effects in children, Pittsburgh, University of Pittsburgh's Scott Needleman was very strongly involved in this. The CDC level of concern had been dropped from 15 to 10, which allowed us to push out the lead from gasoline. It eventually was dropped to 5. The magic number that we're concerned about was dropped to 5. But the committee that did this in 2013 changed the wording from level of concern to reference level. Reference level being, 2.5% of the children in a truly national sample, not the kind of grab samples that we tend to have in local communities and cities, but a truly national sample showed of children. So 2.5% of our children in 2013 were above this reference level of 5. And the goal is to, every time this national survey is repeated, to drop it even further depending upon where 2.5% of the children are. We want to keep pushing this down. One other number, again, for the perspective issues. CDC recommends consideration of using drugs to remove lead from the body, and you can, but these have some toxicity to them. At a blood level, that's not 5 or 10 or 15 or 20, it's 45. That's the level where we get into, if you will, the medical treatment, as Dr. Hacker told you. This is a public health issue. Well, What about paint versus water as sources, which certainly has been an issue here in Pittsburgh and elsewhere? If you look at Healthy People 2020, it's a CDC effort done every 10 years to look at what our goals should be as a nation, everything from motorcycle helmet use to blood cholesterol levels. There are two related to lead. Both are best achieved by focusing on paint. One goal is to simply eliminate any blood lead levels higher than 10. I doubt if you can get to 10 just with the kind of water issues that we have here, or even in Flint. It's really hard to do that. Kids just can only drink so much water. Paint, on the other hand, it's amazing how many paint chips, and you heard about that, a little kid's stomach can have. Toddlers are notorious for putting lots of paint in there. Paint can lead to dangerously high blood lead levels above 10. So if you want to go after that, that's where you have to go. The second CDC Healthy People 2020 goal that's related is to eliminate differences in blood lead due to race and social class. Flint is unusual in that it is an environmental justice issue related to water. For most of the country, certainly for Pittsburgh, it's basically the difference due to race and social class is an inner city issue primarily due to lead paint. So meeting this goal requires that we focus on paint, not to ignore water, but that paint be the focus, and we don't at all take away from what we're doing on paint. We have to keep going more of it. Let me finish by pointing a finger a bit onto media. And, I'm not much for media bashing, but there's actually harm being caused to children by how this issue is being covered. I mean, hyperbole is fine. Lots of good reasons for it. But when you tell children that they are brain damaged, they are unable to learn, that's a self-realization, that's a self-approach that basically they internalize. And not only that, their teachers, their family, others, the ones who might want to hire them in the future, also keep that in mind. These kids are from Flint, they're from a water-polluted area, their brain is severely damaged. You don't have to believe me. Let me quote President Obama, who gave a speech in Flint. And when he did it, he said, I don't want anyone to start thinking that somehow all the kids in Flint are going to have problems for the rest of their lives, because that's not true. And I don't want that stigma to be established in the minds of kids. My graduate student colleague, Belinda Berry, is here. Belinda's going to be looking for a job, so raise your hand, make sure people see you. She's looked at the media coverage of that speech. It's enormous coverage. No coverage at all about the stigma issue, about the negative impact of having children believe that they are harmed to such an extent by the lead levels of Flint, which, as far as I know, never have gotten to a level of 10. And again, I'm not justifying Flint. That's simply the wrong thing that was done there. But the issue is that these kids should not be treated, should not be told that they have been extremely damaged. And you've got lots of quotes out there talking about brain-damaged children. Finally, let me make a prediction of what's going to be in the press, in part in the media, because of what we don't understand as well as we should by the press, by the public, about blood lead. You're going to have headlines about the fact that the blood lead levels are going to go up in Pittsburgh in the next few months. They will. And you heard why. They go up everywhere in those couple of months. It's the summer. Kids are out, toddlers are outside. We want them to be outside. That's the healthy place for them to be. They like dirt. Dirt has lead in it. They put their hands in their mouth with the dirt in. They bring the dirt into their homes. This is when blood lead levels tend to go up during these 3 months. They went up in Flint. They made such a big deal about it as if there was some horrendous thing happening because of it. But really, that's what we would expect to see. So we need to get lead out of children's brains. Its subtle effect, make it a public health issue. But please stop repeating nonsense stories about extremely dangerous lead levels or toxic death or permanent brain damage. And when the lead levels go up this summer, don't just listen to some politician. Get the facts. Thank you.
Thank you, Dr. Goldstein. Dr. Dowd?
Thank you, Dr. Harrison. So just to clarify, I'm not a medical doctor. I appreciate that. I do have a doctor, but it's not medicine. My name is Patrick Dowd. I'm the Executive Director of Allies for Children, and I'm joined today with Erica Fricke, who's our Health Policy Director, and we're really actually quite proud to be here, standing with Dr. Hacker in the Health Department and all these very talented physicians and very knowledgeable individuals. We're an advocacy organization. We don't do medical work. We're advocates, and we care a great deal about policy. And if you look at these charts, there's a story here. And that story is that over a large number of years, a very large number of people have been working systematically and collaboratively to put in place policies that have actually improved the quality of life for our families and particularly for our children, and improved outcomes for kids over the course of time. And what you also see is the projected story forward. The health department wants to continue that work here in Allegheny County. And we're proud to stand here because, in fact, this health department, like us, understands that policy doesn't happen in one particular place. It doesn't happen in the health department alone. It doesn't happen in one single jurisdiction, the city of Pittsburgh or Mount Oliver or Munhall. It happens in a collection, in a gathering. And it happens with a series of steps. And I just want to, there are a large number of steps, but I just want to call out a couple of the steps that we're aware of and that we're proud to be working on with the health department, and that Dr. Hacker has taken in actually a relatively brief tenure here in Allegheny County. So as you heard, there's coming forward a policy for universal testing. That's not to say that there hasn't been testing. There has been, but as others have said before me, Dr. Moss particularly, that testing has been sporadic, and our goal is to see it as a more systematic approach, and that's something that we believe the health department board and the management team itself will put forth and will be successful. We've seen this department, the board and its leadership, bring down those levels, the reference levels and the action levels here in Allegheny County from 15 to 10. That was an important step. That really means we're going to begin, we have been seeing increased in action on the part of the department. We've seen the department apply for federal public grants as well as local private grants to bring resources where, we all know this, tough times, it's not easy to get resources. So this department's being creative and innovative in ways that we haven't seen in this department before to bring resources to bear for these questions. They've thought about their internal operations. They've applied a full position where they didn't have one. They had a position, they were reevaluating it. They actually directed that position towards lead testing, and they've cross-trained all of their home inspection folks to make sure that they are doing that work as well. So it's thinking creatively about the resources that they have at hand. And something that's particularly important for us at Allies for Children in recent months, I think it was early 2016, the department director, Dr. Hacker, went to the Department of Health for Pennsylvania and the Department of Human Services for Pennsylvania and said, look, for early intervention, and I'll talk about that in a minute, for early intervention, you need to drop your level of action down to 5+. So any child that's tested at 5 micrograms per deciliter, and again, I'm not a doctor, so I can't really tell you how much that is, but that's the number. Any child that's tested at that level should qualify for early intervention. And here's something that's very important. As we've heard repeatedly from these physicians, this is a concern. We as a community need to be concerned about lead levels, but it is not something for which we should stigmatize children. It is something for which we should apply resources, and early intervention is just one good example of a high quality, highly effective service that this department is advocating for our children and here in Allegheny County very successfully. Early intervention provides services to those families that have children 0 to 5 who probably are delayed or possibly manifesting some signs of disability, and they provide those services to families to help. By the way, these would be kids who are often in the NICU or who have low birth weight or specifically, explicitly stated, have high blood level, or blood levels, sorry, not high. And then these services are able to help children overcome those delays or help families apply strategies to solve and deal with those disabilities so that those kids can be successful early in school and, of course, over the time in school and ultimately in life. That is a really important part of the work of this department, stepping out and advocating on behalf of the kids here in Allegheny County and doing so effectively and doing so with partners, not by itself, but working in collaboration with those others in government as well as outside of government. So this department clearly takes this lead level threat seriously. It's not attempting to stigmatize or damage those children, but rather working to help provide the resources necessary, A, to identify, and B, to serve. We're also proud to work with this department and Karen Hacker particularly because, listen, for the first time in a long time, we have a department director here in Allegheny County that understands we have one health department, but we have 129 municipalities, we have 41 school districts, 36 water purveyors, including Penn American, a private company serving part of the city of Pittsburgh. We have Medicaid providers, we have other folks in this community who are working with our children, and it's this department that is at the center of that, working to build the relationships necessary to achieve the policy objectives in the school districts, at the water authorities, at the health providers, making sure that our children have what they need when things are identified like lead levels. And we're proud to stand with a department that understands the importance of this policy work and the fact that it is done largely in collaboration across jurisdictional lines. Anybody that thinks that it's going to be this problem is going to be solved in the Allegheny County Health Department is missing the target completely. So we're again proud to be here and working with the department as they continue to work to solve this problem here in Allegheny County. Thank you.
Thank you, Dr. Dowd. What's that?
Dr. Dowd, he just got a doctor.
So before we go to questions and answers, Dr. Hacker is going to make a few comments.
Yeah. Before we just go into questions and answers, I did want to just point out, and you heard a lot about some of the things that we've been doing, particularly over the last year, but this department has been working in the area of lead for decades, literally. So literally last year in February, I did an op-ed piece, you may remember, in the Post-Gazette, and then since that time, despite the fact that we lost some federal funding, we repurposed a position as a lead inspector. We're training our other housing inspectors so that they too can do lead inspection. We dropped our level of inspection from 15 to 10. We have been working on improving all of our educational materials and what's on our website. We've been out in the community with PWSA at all of its community meetings as well as other community meetings. We were very happy that the Allegheny County Economic Development, as in partnership with us, was able to get a large grant for actual remediation of homes, which should be starting very, very soon. We've applied to the Hillman Foundation for additional funds so that we too can actually do some lead testing here at the county, as well as improve our educational materials and look seriously into all of the different policies that other jurisdictions have promulgated to see if those may be things that we want to consider here in Allegheny County. And lastly, a number of things on there, but lastly, you can see that now we have an upcoming vote that will be happening literally in 2 weeks with regard to universal testing. But I want to close with saying that everybody in Allegheny County, because of our large volume of housing stock with lead paint and our industrial past, as well as our lead pipes, we know that lead is present. And there are things that you can do as a parent. There are things that we can do in government. There are things that educators can do. There are things that community organizations and the funders can do to really help to decrease the risk that our children have from lead in their environment. And so we've just put some of the things here. You've heard that from the prior speakers as well, but just to remind people, be aware. Don't do your renovation yourself when your child is in your home, because that's one of the most dangerous times as well. You heard about the summer, the paint chips, but it's also the dust from the paint, and even sometimes if you just rub the paint, you see that film on your hands, that can even contain lead. As I mentioned before, I know that there's a lot of work now going on even in testing soil. We have colleagues in other departments and in other organizations that are working a lot on that. And so it's really about being careful with your washing techniques, being consistent in making sure that when things are falling apart, that you try to make sure that they're in better shape. We are happy to answer any questions, and we are very happy to work with any families as they move forward, despite the fact that our resources may only limit us to doing in-home inspections at this time. With the above 10, we are really looking, as Dr. Goldstein meant, to go above and beyond and consider ways to outreach to those families, provide them with the information they're needing, and really be consistent with our CDC colleagues' recommendations. So I think with that, I don't know, Dr. Harrison, if there's anything else, and we'll open it for questions.
No, it's just, so we're going to go to Q&A, and I would ask folks to please state their names and affiliations. Yes.
Michelle Nacarati-Chapkus, and I'm Executive Director of Women for a Healthy Environment. I had a question for the physicians on the panel today. Because lead has a half-life of 26 days, about 26 days or 1 month, is there a concern or a thought to try and identify any children who may have been exposed to blood, have blood levels, but because of the half-life of only the 1 month period, are they being missed, for example, and need early intervention services, but we won't know that because they haven't been tested within that last month of exposure?
I can handle this in toxicology.
Dr. Goldstein, yes.
I'm a physician. I've taken care of kids with lead poisoning. Yeah, it's always a problem having to understand, particularly when you have something like a paint chip, how long the paint chip's going to be there. Sometimes the half-life isn't really that important because the paint chip is sitting in the kid's gut for a month. And so it's continually, the acid is continually just eating away at it and taking more and more of the lead out. Sometimes if there was an acute exposure, and yeah, you're right, a month later, a lot of it will be gone, well, half of it will be gone, and you'd have difficulty with it. So it's always a time issue, but it's pretty rare that you're going to miss a paint-ridden household, a kid just suddenly not having any paint, any lead in them because it's past that time, unless they went away for the summer or something of that nature.
Dr. Hacker, did you want to?
There was just one other thing that I want to mention in terms of our next steps, and I apologize, there's been a lot on our agenda today. I do want to mention that, as I said, we are working on our work with the individuals who have levels of 5 to 9 to be able to offer them those kinds of services in terms of case management and education as particularly as pediatricians work with those individuals. I also want to mention that we have an outstanding Hillman grant right now that will help us in many ways to improve our educational materials. But the other thing I want to mention is that I've spoken with the county exec, and we are intending, and he should be announcing this shortly, to launch a task force on lead to specifically look at things like further analysis of the data that we have, additional strategies for intervention, as well as potential policy strategies that we may be taking. So look forward to hearing that as well, and I'll step back.
Yes. Dr. Moss?
I had one more comment, and also in response to your question, that obviously we won't know every child who's at risk. You're pointing out one reason, that the short half-life of lead. So one of the things that we as pediatricians do is really try to promote prevention as much as possible. One aspect of prevention that wasn't mentioned was that good nutrition is actually preventive of lead absorption. So diets high in iron and calcium compete with the absorption of lead in the gut. And so again, one of the risks for children in low-income situations is they often have poor nutrition, and that puts them at added risk for lead exposure and lead absorption. So again, all of our children should be counseled about getting good nutrition and washing their hands before they eat and taking off their shoes before they come inside so they don't track anything in unknowingly. So those kinds of preventive measures are also quite important.
There have been some reports.
I'm sorry, can you introduce yourself, please?
Bob Mayo from WTAE. There have been some reports concerning lead levels in children in the city versus the county, suggesting that they were decreasing in the county but increasing in the city. Does your data show that, and what's your response to any reports that suggest that the level is growing among city children while decreasing among children in Allegheny County outside the city?
Dr. Hacker, do you want to field this one?
Yes. So if you look at, I believe that was taken from data which has been on our website, and if you look at the third placard there, what you'll see is that there was a little bit of an uptick, right, in 214, in the lead levels. We're talking less than a percentage point compared to the county. However, it has since dropped down again, and again, given that there is variability, we have certainly done the statistical analysis here. We have not found what's considered, it's called statistically significant. I know that that's sort of confusing to folks, but the bottom line is that those numbers are going down. And if you look at the levels of 5 and above, which includes the levels of 10 as well, it's very important to know that the levels of children with 10 are literally under 50, the numbers of children that we're talking about. The actual numbers have all been going down. This is based on percentages, and it's based on the number of children who are screened. And as I mentioned earlier, That's extremely variable. One year you'll get more kids screened, the next year you'll get less. So that isn't what we would call a representative sample. It makes it very difficult for us to actually understand that, which is exactly why, particularly because of the concern around the issues with PWSA, that's exactly why we did that second analysis, as the CDC did, to look to see if there were any particular upticks. And using that information, we did not find one.
And also, follow-up, if you could center up closer to the microphone.
I am so sorry.
I have to go over there once to introduce
I apologize.
what you're saying. But on the matter specifically, and you had all addressed this earlier, but to come back around to it, the children with the higher levels, have you determined whether or not water as a source was a factor in any children that did have higher levels?
So, and we have checked that for the last 3 years in particular, since actually 2014 and before. We have only twice found that there was a high lead level above the level of 15 in people's water. In one of those, which was in 2014, there were so many significant other lead sources in the home that we did not feel that that was the primary source. And when those other components were remediated, that child's lead level did decrease. The second one, which happened in 2016, we actually found that when we went back and did multiple samples, by the way, we always do a first draw. We're one of the few health departments that has always tested the water in our investigations. We did not find on all 4 of those additional samples the water level was below the action level, and the child was chewing on the windowsills. So there were very obvious other risks for that particular child. We dropped our level to 10 in November, and since that time, we have not found any scenarios where the water in those children's homes had an elevated lead level.
So summarize the conclusions that you would take from the 3 points.
The conclusions we have taken is that we have never found water to be the primary source of lead poisoning in the children in whom we have investigated these scenarios.
Excellent questions. Yes, so, yes.
Hi there, Teresa with the Review. I have a question. Is it Dr. Goldstein? You mentioned you addressed the media as far as stigmatizing the children and such. So I'd like to put a question back to you. The CDC, on their website, they have a research that found children with levels between 5 and 9 had lower test scores in school and an increased likelihood of learning disabilities. So as you know, there are some concerns with lower than 10, lower than 45. So it's important to educate those parents about that, and the media is one of the ways we can do that. So how do you suggest we do that without causing a stigma?
Well, I think what you just said is perfectly appropriate. But the difference between what you said and brain damage for life, which toxic death, now, I know you didn't say that, and actually I'm with you, my pen was leaking, so I'm an ink-stained wretch now. But no, the kind of quotes, and we've got lots of them, headline, toxic death in the Flint waters, brain damaged for life, over and over again, and again, President Obama's quote, which the media, in its extensive coverage of his speech, never said anything about what he said about stigma. Those are the kind of things I think need to be corrected. I think we need to recognize, again, that, we put it this way, people who perhaps on average had a blood lead of 16 should not be telling kids who have a blood lead of 5 that they're extremely damaged for life.
Okay, thanks. And to Mr. Hacker, I have also a question, if you don't mind. You mentioned the task force that will look at potential policy changes and looking at other municipalities handle this. Can you say at all what that might be, and will it involve harsher penalties for landlords with flood in their properties?
So I think that's an interesting question, and as you probably know from looking at other communities around the country, that is one of the areas that they have begun looking at, right? And some of them actually have those regulations. I think we have 130 municipalities. I know Patrick said 129, but I think it's 130. And each one of them manages their own inspections for their own housing. They do their own zoning requirements. So the challenges around these kinds of things, I think it's going to take all of us to really look at them and to figure out whether or not this is something that we can move forward with, which of those communities might be willing and interested. As you probably know, even the level of inspection that goes on in each of these multiple communities is quite different. And the concept, for example, of the inspector going in and also doing lead inspection at the same time that they're doing housing inspection. Well, if that's happening regularly and that particular municipality has a group of people who can do that work, that might be another possibility, but again, it is not consistent across the whole county. So I think the main thing is to do exactly what you're talking about, do the research, figure out what the challenges might be and what the opportunities might be, because that's not the only one. As you probably know, there are a number of legislation bills in our own legislature that have been percolating along. We don't know which one of those may move forward. So I think part of that task force responsibility would be to look at all of these various different possibilities.
Yeah, I was referring more to the county home inspections they do with confirmed lead levels over 10. So would you need municipalities to do anything for that, or to get all standardized?
So I guess I'm not following. Can you reframe it then about the particular inspections over 10? Because I thought we were talking about landlord policies.
The county home inspections that are done for lead when there's a confirmed level of 10 or higher.
Uh-huh.
I was wondering if some of the things the task force might look at is harsher penalties.
Oh, harsher okay, so that's a little bit different. I thought you were talking about specifically about landlord policies and regulations, which do.
When they have
Those do exist in other areas, yeah. So they certainly could look at that as well. I think at this point in time, we are citing the landlords. I know there's been some concern about how long it may take those landlords to make progress. On the other hand, we don't want to have to displace families. That in and of itself is a very challenging endeavor. We want to work with both the landlords and the families to get the work done. And if they are making progress, we would prefer, I think, to work with them, because the cost of doing these remediations there's actually cost to it. And we'd much prefer that they're using that money to make the changes that need to be made than fighting us in court, if that's a possibility. But I do understand where you're coming from, and I think that's certainly an area that we can look at more.
When and how widely does the health department test for lead contamination in the water?
The health department does not test for contamination of lead in the water. That is the job of the actual water system. When they exceed the lead and copper rule level, they are required to go through a whole series of action steps, which includes having the water availability, water testing availability. So anyone within the PWSA system, and I believe beyond, if you would like to get your water tested, you can literally go online and it will arrive at your door, and you can submit that for testing.
So just to clarify then, when you refer to findings or observations about whether or not water may elevated levels, that
Yes,
I
I'm
understand
sorry.
you're not doing widespread testing, but obviously you're looking at water in some way. Explain
How we do that. I apologize, and to clarify. In terms of our home inspections, when we are doing a home inspection, we are doing a multiplicity of environmental testing. We are testing all the surfaces for lead paint. We are generally testing soil if we determine that a child is playing in that soil. And then we are doing a first draw of the water. If the water level at that first draw is above the lead and copper rule action level, we will go back and we will take additional draws of that water at varying times, and I'm not sure I can tell you the exact specifics about how that is taken, but it is in line with all of the EPA standards that are required.
So when you say you don't test, it would be fair to summarize by saying you don't test community-wide, but you test in specific circumstances.
Correct, and again, thank you for clarifying that. I apologize if there was any miscommunication.
Yes.
Rick Dagan with KDK. We've talked an awful lot about blood levels, what it is having to do with micrograms per deciliter, et cetera. We haven't talked so much about how many children are currently being tested in terms of the number that are out there that we're seeing in our hospitals, young children, et cetera. Where are we now in Allegheny County? What percentage of children are being tested? I know that you'd like to increase that number to get all of them. Where are we right now?
I believe, and I got this morning, so I'm not sure I'm going to be able to find it immediately. I believe we're at about 15% of the county, which is certainly not where we would like to be. Yeah, and I can get you the specific data if I cannot find it today. With that said, we do know that Medicaid children, because there is a recommendation and actually a requirement that Medicaid children are to be tested. We believe that those are much higher, but since we are not able to see the information about what insurance the individual has, it's very difficult for us to do that. I believe the state has looked at some of that, and their rates range from 40 and above. I think we have colleagues here, right? We have colleagues here from UPMC. Do you want to say anything?
I didn't get the exact data, but there are quality measures for Medicaid to make sure that children with Medicaid insurance are tested for lead at least once by age 2. And I believe the rates, but I can't be quoted because I didn't look it up before this, but I believe the rates for the Medicaid population is about 80% testing or higher. But that, again, is that is just at least having one test by age 2.
I'm going to look it up right now and see if I can get you the exact.
Other questions? Okay, any other, yes, any other comments from our panel? Okay, thank you very much. And as I pointed out, the Board of Health is looking very much to taking a vote on the universal screening regulation. And I think it's really impressive all the activities are going on in the county, and we look forward to these activities continuing. Thank you very much for attending.